A new collaboration has been formed between two First Nations groups and NL Health Services. That's after a Memorandum of Understanding was signed in Corner Brook today. NTV's Becky Daley has more.
Today marks a historic moment for Indigenous people and the province's health accord, an MOU that has been in the works for quite some time.
We are going to move forward immediately in how we engage with the Indigenous nations on a distinctions base, and how we improve the health care of things that are important to those nations.
The significance of this, plays over and over in my mind about what this means for us, not just as Indigenous people, but non-Indigenous people.
The MOU promises to strengthen the relationship between health and culture and give Indigenous people a seat at the table where their values are heard.
A consultation is a big thing, to sit down and just talk to us and see how we want things done, sit down and talk to the community, sit down and talk to their leadership in the community, figure out what's the best way to do things for us.
Our uniqueness is that we're on a reserve. So, that makes a difference. We are, pretty much handle our own programs, services.
NL Health Services CEO Dr. Pat Parfrey says they are in the process of hiring an executive lead for Indigenous health who will be a voice for First Nations people.
Because they have different needs and different requirements and different capacities, etc. So that it's almost self-evident that in dealing with the Indigenous nations, we have to respect their individuality.
Minister of Health and Indigenous Affairs, Leela Evans, was also in attendance today and was quite emotional when delivering her speech, reflecting on why this memorandum is so important.
I've come from a region where people have died who should not have passed away because their illnesses were treatable. I've come from a region where a lot of times people start getting the treatment too late. And also people living in the communities who have been harmed by the lack of access to healthcare now don't have the full quality of life that they deserve. And so for me, it is emotional.
As a young Indigenous woman having my children years ago, I felt I had to leave my identity at the door. And I know that I've talked to a lot of mothers that have felt the same. And not just at that point, all throughout our lives, we have health crises and health experiences that we may not feel that we can bring our Indigenous identities with us, that that part of us is kind of left outside. And now we want to make sure, not just with Indigenous artwork on the walls or, a medicine wheel on the floor or however you want to put it, but to really feel comfortable, to be ourselves and to share our experiences without judgment.
NL Health Services says they have a list of goals moving forward, from mandatory cultural safety training to implementing an Indigenous identifier for health data and developing bilateral agreements. Work is already started. Other Indigenous governments may sign a similar MOU at a later date. For NTV News, I'm Becky Daley in Corner Brook.